My name is Courtney, I'm 18 years old. I started working in this practice in September, so 6 months now. Obviously when you start you have to get used to it and learn quickly because there's lots of things you have to remember. I'd be shadowing, and then if the instruments were set up, I'd take a picture so that if I was by myself I'd know what to set up, and I'd write notes as well. Personally for me, I think it was intense because I had to learn very quickly. But luckily, dental nurses would help me if I needed help. There was times where I thought, oh gosh, I'm asking so much questions. But it will definitely help you should do more. And even now I'm still getting used to it, and everyone's helping me very well, so I'm very thankful. There's way more than just setting up and just sitting there. For example, you do charting, make sure that the patients are comfortable. Sometimes you have to do reception as well, so you need to know your communication skills. So now I'm able to do that. And I'm still improving, obviously, because before I wasn't really good at communicating. But now I'm very confident because I communicate a lot. So I think it will definitely impact your skills. If you're thinking about applying, my advice would be to have supportive people beside you. Definitely go for it. Take pictures. These kind of roles are for people that are definitely calm, definitely need to believe in yourself, because there are times where you don't believe in yourself and you just want to give up. But you shouldn't give up. Just go, do your best, ask people for help. Don't step back. If you want to do it, then do it. I'm hoping to go to university and study hygiene. I really want to help people make their gums and teeth healthier and feel more confident smiling everywhere they go.